When giving first aid to your pet, it's always worthwhile thinking about what's normal, and this will help you appreciate when something has gone wrong. If you look at your own pet when they're well, when they're resting, and there's nothing going on, it's a good time to just appreciate the changes, the things that you might feel when you go do an examination from the top of their nose, tip of their nose, right down to the tip of their tail. So what I would start to do when you're looking at your pet is start at the head, and what you want to be looking for is any kind of pain or anything that's bothering them when you're touching them. So start with the ears, touch the ears. Most dogs will be fine with you touching their ears if it's something they're used to, but if it's uncomfortable, it may be that they've got something down their ear, or as you're touching them, you may find some sort of scabbing or crusting that could indicate that there's a wound there. So just touch them and appreciate what's normal. You can also look at their eyes. They should be nice and open. They should be nice and shiny, and there shouldn't be any sagging or drooping of the eyelids. In their mouths, hopefully they will let you look and examine their gums and examine their teeth. You want to sit, boy? Sit down. Good boy. And what you should be able to do is look at the colour of their gums. So you can see here a nice healthy pink colour of gum above the tooth there. And you should just be able to press that with your finger and do what's called a capillary refill test. And this is where you're just going to put a little bit of pressure on the capillaries that run inside the gum there. And if you have a good circulation, when you put pressure there, you're initially going to stop the circulation through those capillaries. When you take your thumb off, the blood flow should come back very quickly in a healthy, good circulation. You can then also have a look at their teeth, make sure they're okay. Sometimes if they get an injury to the mouth, there may be blood coming from the mouth. So it's a good idea just to get your dog used to you touching their mouths and trying to open them. Then you're going to have a good feel along their back, along their legs. Make sure you're able to examine their feet, touch all their digits, feel their nails. And if they do have any problems with you doing that, then you know potentially that they have injured that area. You want to feel down their shoulders, down their hips. And when you're doing that, you're going to feel around the joints. It's a good idea to do both legs at the same time so that you can appreciate if there is a change on one side that isn't there on the other. You then also want to make sure that they're happy to move around and there's no limping, no hanging of the head, no arching of the back. And when you're feeling along the back here, you can also just rub your hands along the side of their abdomen and make sure that it is nice and relaxed. If there's any tension or if the abdomen feels hard at all, that's probably not normal for your dog. But as I say, it's really useful to appreciate what's normal so that when something does change, you're able to recognize that it's not normal for your dog.